Aspen Medical was first contacted by the Department of Foreign Affairs and Trade, and the scope at that point in time, as we knew it, was that Afghan evacuees and Australian visa holders were to be evacuated from Kabul via the United Arab Emirates, finally to various locations in Australia. It was requested that we provide medical support in the United Arab Emirates. The United Arab Emirates is, in fact, our second largest office. We have an office in Abu Dhabi. And so, to that end, we were in a position to immediately respond for the government. Aspen Medical has various contacts and networks, logistics supply in that region, so we're well positioned to respond. The medical services that we delivered was firstly primary health. We also provided basic laboratory services, provided ambulance transport services, assisted with flight specialists on the flights from the United Arab Emirates to Australia. We also had various specialists engaged on the project, so that included emergency physicians, paediatricians due to the large number of Afghan children, midwives, obstetricians, so quite a wide range of specialties working on this project. The contract length was unspecified. It was an uncontrolled environment in some ways. We were getting updates day by day as to how the project was progressing. So there was a number of Afghan evacuees that we needed to evacuate. We didn't have a definite number at the commencement of the project. As you can imagine, a project that's as dynamic and I guess unpredictable in some ways as this project, updates occurred daily with regard to numbers. The initial numbers that we were given was originally around 400 evacuees, and that number ended up multiplying probably by a factor of 7 or 8. The language barrier was an interesting challenge, but one that I think we were able to address fairly easily. One of the ways in which it was addressed is we actually had a multinational team. So we had people from all around the world, including fluent Arabic speakers. We had one Pashtun speaker. The government were able to provide us with translators, but often we found the level of English amongst the Afghan evacuees was quite good. There was always the option of using an Afghan evacuee amongst the various patients to assist as well. So when we were moving large bodies of Afghan people, say when we were doing PCR testing or something of that nature, often the translation came from within the group of Afghan evacuees or the Australian visa holders. The volume that came through, I think, was perhaps one of the biggest challenges. I think that was the case for two reasons. The first is the large number of Afghan evacuees had to be managed in some way. And so we went through this process of fitness to fly. We had to satisfy the Australian government and ourselves, with the Afghan evacuees being under our care, that the Afghan evacuees were fit enough and stable enough to fly. But that required management of a very large volume of people. That was a challenge, and that required close collaboration with Australian government doctors, so mainly the Australian Defence Force, but there were some other Australian government bodies involved. We had to collaborate closely in order to manage just such a large volume. It also meant that we had to have strong systems in place almost immediately. The high volume of Afghan evacuees also constituted a challenge insofar as high density living is concerned. They were living in close proximity. Back in August of 2021, we were in the peak of COVID-19. And so an outbreak of COVID-19 in that circumstance would have created extraordinary challenge for our clinicians and for our team. So it was imperative that we manage that rigorously from the start. Although we did have COVID-19 confirmed cases, we were able to manage that effectively through identification, screening, isolation. I think the team did an extraordinary job in ensuring that an outbreak didn't occur. In terms of project outcomes, I think the first significant outcome was the deployment of the clinic. We were asked to rapidly deploy a clinic, and we were able to do that, importing it from Europe into the United Arab Emirates within 72 hours. So that was an extraordinary achievement. It wouldn't have occurred without the collaboration of both the Australian government and the government of the United Arab Emirates. So that was a key achievement. Another achievement, I think, is the control of COVID-19, the fact that we were able to successfully contain COVID-19 when there were reported cases in circumstances of such dense living conditions, I think is a great achievement. The team on the ground treated 715 patients over 19 days, 15% of which were children, and we had a comparatively large volume of pregnancies as well throughout, which causes numerous complications for the clinicians. So the fact that the team were able to get through that volume of patients is significant. I think lastly, for our company and for the business, it's an honour to be part of such an extraordinary humanitarian effort, a humanitarian project of this nature, and to play some role in assisting the Australian government.